My name's Autumn. We're going to be doing the 6-minute walk test today. It's a variation of the 12-minute walk test, but it's for people with heart or lung disease that aren't able to walk for a full 12 minutes. It does not provide overall organ system specific things, but it gives us a measure of submaximal functional capacity. Most activities of daily living are done at a submaximal level, so it gives us an actual functional view of each person's capabilities for that. The strongest indication for a 6-minute walk test is for measuring the response to medical interventions with patients with heart and lung diseases, as well as an overall view of morbidity and mortality of each client. The absolute contraindications for the 6-minute walk test include unstable angina during the previous month and myocardial infarction during the previous month. The relative contraindications are a resting heart rate of greater than 120, a systolic blood pressure more than 180, or a diastolic blood pressure more than 100. Patients with any of these relative contraindications should consult a physician, and they will state whether a physician needs to be present for the actual 6-minute walk test or not. Patients with the previously mentioned risk factors should keep in mind that they can do the test at their own pace, so they can stop and rest at any time if they need, so they don't have to stress themselves out, they are always able to stop. Safety issues concerning this test are testing should be done where there's easily accessible medical emergency procedures, like a crash cart should be available for patients with disease who might need more severe help. You should have oxygen, sublingual nitroglycerin, aspirin, and albuterol available for those who need, and also a telephone needs to be near in case you need to call for help. A technician should be trained in cardiopulmonary resuscitation with a minimum of basic life support by the American Heart Association. And physicians are not required to be present unless the physician who ordered the test requires that they be there. And if the patient is on chronic oxygen therapy, oxygen should be available or administered as they're required, which we'll go over the requirements for that later. Reasons for stopping the 6-minute walk test would be chest pain, intolerable dyspnea, leg cramps, any staggering, diaphoresis, and a pale or ashen appearance. Or if they feel they need to stop, they can at any minute. The technician should be trained to recognize any of these so that maybe if the client isn't feeling it, they can notice it. This test should be performed indoors in a long, flat, dry hallway, and if the weather permits, it can be performed outdoors. You need a 100-foot long hallway, and you need to mark 5 feet, like we've done here, in between 5-foot increments, and then the 2 cones need to be placed at the 100, just up far enough so that they can make the turn and still stay within 100 meters. And also, if you can see down there, we've marked the starting line so the patient knows exactly where to start. We'll also need, if you want to move over here, we need a stopwatch. You can use a mechanical lap counter, or you can just you can mark off on your own sheet the laps. The 2 cones, a chair for the patient to take all his resting and post-test measures. If the patient needed, oxygen must be available, sphygmomanometer, the telephone needs to be around, and an automated electronic defibrillator should also be available. The patient should wear comfortable clothing and appropriate shoes for walking. If they would need any walking aids, they should use those during the test. If they need a cane or a walker, those should be used. They should be on their usual medical regimen, like if they take any medications, just take those as normal. A light meal is acceptable for the workout, and the patient should not have exercised vigorously 2 hours before the test. And that's it. Jake's going to go over how to actually run the test, and then we're going to perform it.
Okay, since there is no warm-up required for the test, we just ask the subject to sit here. I'm going to take his resting measures using, first I'm going to use pulse oximeter. This is actually going to measure his pulse and his hemoglobin saturation levels. Just to go over this a little bit before we actually get into it. His normal levels should range from 95 to 98%. Anything at 90% level is common. Anything below that, from 85 to 90%, indicates respiratory failure. So we're shooting for a good range between 95 and 98%. So now that he's rested for 10 minutes, I'm going to go ahead and I'm going to go take his blood pressure to start out with. Okay, next we're going to be using the pulse oximeter to measure his heart rate and oxygen saturation levels. Is that a normal range, which what we want at a 66 pulse rate. Next, I'm going to ask him some general questions before he actually begins the test. His height in inches, just some normal stuff here. You know your height, Charles?
69 inches.
He's male, single, weight in pounds.
244 pounds.
Okay. And are you on any kind of medications whatsoever?
No, I'm not.
No. Okay, I'm gonna have you stand. And I'm gonna rate your baseline dyspnea and overall fatigue using the Borg scale. So, I mean, are you feeling anything at all? Do you feel off balance? Anything going off a scale from 0 to nothing at all to very, very severe?
Nothing
maximum?
at all. Zero.
Nothing at all? Okay, that's good. Okay, next I'm gonna set the lap counter at 0. And I'm gonna get ready to time Charles with the 6 minutes. The objective of this test is to walk 6 minutes down the hallway as far as possible. After the 6 minutes is up, you'll probably feel like you're out of breath. You may feel like you need to stop. If you feel like you need to stop at all, just stop, lean against the wall. Either that or just, if you want, just take a couple deep breaths, but we encourage you to finish the test. You should pivot briskly around each cone. So when you come around the cone, you're going to be coming, pivot, turn back around. Just make sure you're getting a good circle. And I'm going to use the counter to keep track of the number of laps that you complete. After the 6 minutes is completely up, if you're beyond any kind of indicator, we're just going to measure off from that point. So, do you feel like you're ready to take the test?
Yes.
Okay. So, I'm going to tell you when to go. We'll start you off. Autumn's going to record everything over there. So, ready, set, go. Stop. Test is now complete. Stop from there and we'll measure off. Got it on? All right, we're going to now use the Borg scale once again to measure how high your fatigue levels are, from 0 meaning nothing at all to 10 being the very, very most severe. How would you rate that?
I rated 1.
1. Was there anything at all that caused you to not go further throughout the test or anything like that?
No.
No? Okay. I'm going to measure your oxygen saturation levels and your pulse once again. Okay, as you can see, he's still at a good 95 to 98% range, and his heart rate is at a 72% pulse rate. Or not percent, just 72 pulse. I have a blood pressure of 120/90. I want to congratulate you on the good work, and thank you for participating.
Thank you.